What's up, NLB fam? This is Dr. Fairbanks Jr., and I'm back with another episode. Appreciate you guys. The last month has been kind of crazy with the fires going on in LA and just a lot of destruction and trauma has happened to the city. And now we're working to build it back up. And also, an uplifting news, I guess you could say, a good outlook is if you're a basketball fan, a Lakers fan, Luka Doncic is now a Laker. So that has people excited and excited for the future to come. So a lot's been happening, and now excited to be able to bring these back to y'all and give y'all a lot of value. So with basketball season being underway, we're getting into like regular season play to the middle of the year, coming approaching the All-Star break. Conference tournaments are coming up soon in the next month and a half. Playoff time's around the corner. Right now, it's about keeping people healthy, and this is around the time where you start to see a little more injuries pop up. Injury like seasons are long, games are long. You go through the same routine and you're getting a lot of mileage and contacts on the court. And sometimes they're just wrong place, wrong time, and just inevitable that sometimes an injury happens. And I think when the injury happens, that's you have a couple of courses of action you can take. You can do nothing and just rest and wait for yourself to feel better. That's one option. I don't know if I would subscribe to it, but that's an option. Number two, you could Google, try and figure out what, if you know exactly what the injury is. Google what, do what Google says to do in terms of recovery. That's an option. You could type into ChatGPT, hey, how do I rehab an ankle sprain? And it might tell you some things. Three, you can take the approach that's backed by science and backed by the research and my personal experiences and experiences of other physical therapists who work with athletes at a high level of trying to get players back. And that's what we're going to go through today. We're going to go through that option because I think Dr. Google is great for some things, but in terms of contextualizing an individual injury and what you might be dealing with, it's not the way to go because it's very general advice for a very specific person, and you're going to be different than somebody else. So that's just something to take into account when you're looking into Googling injuries and trying to rehab yourself through Google. Like, don't be afraid to ask professionals for help. And this is what we do, whether it's a AT, PT, sports medicine doc, ask questions, figure out what's going to be the best course of action for you. So we're starting our bounce back series. And we're starting with the ankle sprain, something that we see a lot. And the ankle sprains are never fun, right? Like you land on someone's foot or you take a wrong step and you roll onto the outside of the ankle and all of a sudden it's hard to put weight through it. It's, it's swollen, it's hot. It's not fun to walk around and you're kind of just limited in what you can do, right? So with this episode, real quick, just going into why the injuries happen. What we're going to focus on is just how to recover faster to get you back on the court. I just want y'all to understand injuries happen, but recovery doesn't have to sideline you for an extended period of time, especially for something acute like an ankle sprain. It's not a high grade ankle sprain, like a grade two, grade three, like a complete rupture. But if we're talking about something, a minor sprain or something that should be out a couple weeks, let's make sure that we're giving you all the tools that you need to recover faster, recover well, and decrease the chances of it happening again. So to start out, when we're talking about an ankle sprain, we're talking about a ligament connecting a piece of tissue connecting a bone to a bone. So that's the ligament here. There's three ligaments in the ankle that we talk about when we talk about a lateral ankle sprain, which is the most common. And if there's like little tears, little trauma to the ligament, that's where you see some of the swelling and the heat and the increase in temperature and the pain response is heightened just because your body's sending signals to that area trying to protect it and stop you from hurting it worse. And unfortunately, this is a common thing that we see in the basketball space, just all the contacts jumping up and down, all the running up and down. So if it's something that's more common, let's see what we need to do right now to help us get back if it's something you're dealing with right now, and how two, how do we make sure that it doesn't we decrease our chances of it happening again? So there's a couple of things that I look at where like if we're assessing an ankle sprain, we're gonna look at range of motion, we're gonna look at how you're able to put weight through it, if you're able to put weight through it. We're gonna look at how your joint mobility is looking like. So joint by joint, it's where the bones tend to meet with each other. How does the joint moves? And with the ankle sprain, it's going to be really stiff. It's not going to want to move too much, but we don't want to stop movement happening at the other joints, at the big toe, at the joints at the front of the foot, uh, the knee joint. We want to make sure all the other joints above and below are moving well so that they don't stiffen up and change your movement patterns as you start to recover. So, first thing, if you have an ankle sprain, immediately after, think about just compressing it. We want to compress it with a sleeve, wrap it, just to be able to help it, help fluid not go down towards the toes. And we're trying to push everything up the chain to get into the lymphatic system and exit out the body. The more fluid that we can get rid of is going to be more beneficial for getting your range of motion back and making it easier to put weight through because you're not coming to a hard stop. You have some more range of motion. So that's number one. Number two, contrast. So go in between heat and cold, just to be able to help the calf, the foot complex act as a pump. We want to use heat for vasodilation, and that's where the blood vessels expand and dilate, which allows for more blood flow to happen. And the ice is for vasoconstriction, causing the blood vessels to constrict and narrow. And that contrast effect of going from one to the other allows for blood to flow like a pump and be able to pump up, well, like we were talking about, pump the fluid up and out of the body to get out of the foot and into the lymphatic system. Number three, joint mobilizations. We already talked about this, but just again, making sure the joints are moving above and below appropriately because we don't want a foot to get stiff and then your knee take on more load when you get back to returning on the court. That's just a recipe for, knee pain, hip pain, back pain. We got to make sure things are steady at the foot before things travel up the chain. And then some people like to do like dry needling, acupuncture just to get some muscle activation of the front of the on the anterior tib, the front of the thigh, front of the lower leg, which I think is it can be used like just to help facilitate the healing process. Work with just giving the body different sensations, but depends on what state you're in. Some states don't allow um, dry needling or uh, modalities like that. So you just got to be mindful of where you're at. And then lastly, it's just going to be to load it to whatever is tolerable. This is where I think a lot of people mess up. When you get an ankle sprain, kind of just sit, elevate your foot, and wait a couple weeks, and then go back to playing. But you just setting yourself up for not a good outcome in the future because you didn't prepare your foot for what it needs to be able to do. And if you just rest it, that time off is going to throw off your sense of where you're at on the court. It's going to throw off your balance, it's going to throw off your timing. And if you don't train that, if you don't strengthen the musculature around the foot and the foot itself, you're just setting yourself up to have another ankle sprain. And ultimately, just it could lead to other things which we don't want. So getting ahead of it and just trying to make sure you do everything you can to really just take care of it. And a lot of the things you don't need a lot of like other people or help to do. Compression, get a compression sleeve or get it taped. Contrast, you can get an ice bath and then put your foot in a hot water bucket or whatever, a tub or whatever. Joint mobilizations, you might need someone to help you with, but even just gentle range of motion of foot being planted in your knees, kind of driving over your toes, trying to slowly ease in and out of that range of motion if you got no one to help you. Working on your ankle range of motion exercises, and then trying to load and stand on that foot, whether it's trying to balance on one leg, whether it's, doing upper body stuff while standing on one leg, brushing your teeth on one leg, however you can load it, and just pay attention to how you're feeling the next day. If you have a big increase in pain the next day, it means you did a little too much. We gotta dial it back down. But loading it is going to be more beneficial to helping you get back, along with all the other things that we mentioned, to getting back and decreasing your chances versus doing nothing. Dr. Google might say rice, rest, ice compression, elevation. I don't want prescribed by that. I think you have to be more active in your approach, and I think active interventions are going to lead to active athletes, and active athletes lead to um, better players just because you're able to do more. So that's what I got for ankle sprains. They're not fun. They are a pest and annoying to deal with, and they happen so frequently that we gotta do what we can preventatively. And if they do happen, then we have the steps now to be able to take care of them to return back quicker and better than when the original injury happened. End all be all, do not rest it because that's not going to help you. And if there's any questions that you have about ankle sprains, if you want to know more about like what rehab might look like, if you're trying to rehab through it or want some ideas, we'll add that in our series, and you got that coming up soon. So until then, we'll catch you on the next one. Peace.